The pandemic has exposed significant needs and the need to become more efficient in healthcare and healthcare provision. Innovative business leaders in healthcare and the business of healthcare have sought to bring out technology innovations, AI and machine learning, and data collection tools that reduce the time it takes to get the data together, for example, pathology results or radiology results to the treating doctor, so that when they come to see a patient, the results are in their hand and accessible to those who are part of the clinical team. But in that process, one needs to understand that when this information that is your sensitive, personal, and protected health information, or what's meant to be protected, whilst one provides access to the information to the clinician, the doctor, and the therapist, there are other people who have access to those systems. And you need to ask questions when you sign a consent to agree to give access to your information, because you need to ask what is the legitimate purpose. In the US, it's known as the HIPAA provisions. In Europe, it's known as the GDPR. In South Africa, it's known as the POPI Act. When one looks at how information is processed, particularly when you have healthcare facilities or healthcare groups that have these doctors working in their hospitals and clinics and are provided these solutions free, or what you think is free to make the access to information easier, it is these same facilities that are now offering insurance products, life insurance, integrated communication with insurance and healthcare providers. Just imagine if you're told, well, the information makes life easy for my doctor when I need to be admitted, if I need to be admitted at any stage to a hospital. But that same hospital shares your information that you've shared with only the clinical provider or authorized through that platform to your healthcare insurer. Now, it's fine if that's useful and beneficial to you as a patient, but what if there's sensitive information that you didn't want to divulge, that wasn't meant to be divulged and sensitively could impact you, your life, and your family, and most importantly, provided to an insurance provider, could be used to deny your claim at claim stage without your consent. But because patients unknowingly opt in to make the life easier for these doctors and my peers who don't ask who owns this platform, who else will gain access to it and have a specific confirmation that your information will be protected, many patients are compromised because the information is often accessed and used for purposes outside of just providing health care and being efficient at it. So next time you blanketly just look at an iPad or look at a consent form authorizing your information to be shared and stored by particular providers, ask why. Ask how does it benefit you? Who will process it? What controls are in place? And if necessary, specifically strike out and sign next to clauses that you don't agree with, because it's your right to decide how your sensitive, privileged, and confidential information is protected, managed, and cared for. Because at the end of the day, that information is meant to be used for your health and that of your loved ones as a primary reason.